Welcome back to Company Culture Change, Mindshare Partners interview series capturing the momentum and impact of the workplace mental health movement across the US. I'm your host, Nina Tomorrow. The series focuses on leaders and organizations who are driving real change and on what practices are making the biggest difference for their people. Our goal is simple to share real world examples of what's moving the needle forward, surface what's possible, and inspire HR professionals and company leaders to build cultures where people can truly thrive. In this episode, I am excited to welcome Tara Davis, Senior Director of Internal Communications and Staff Wellbeing at the American Psychological Association. Tara combines empathetic leadership with evidence-based strategies to elevate employee well-being and drive organizational success. In her role, Tara develops communications, programs, and initiatives that energize employees, connect their work to organizational purpose, and fosters a culture where people and performance can thrive. Under her leadership, the APA has recently earned top workplaces recognitions in 5 categories and received the Bell Seal for Workplace Mental Health at the platinum level, reflecting the impact of her team's work. Tara, thank you so much for joining me today.
I'm so thrilled to have this conversation with you. So thank you.
Awesome. I wanted to start by asking about a common challenge that a lot of organizations can relate to. Specifically, you've had success helping your team members combat meeting fatigue and high stress when the organization transitioned to a remote environment. Can you walk us through how you and your team approach that?
I know no one listening can relate to being on Zoom calls all day, right? That is so foreign to all of us. So pre-pandemic, most of our meetings at APA were face-to-face. There wasn't a lot of remote work across the organization. Then suddenly everyone's at home, and naturally we shifted to the next best thing, video for everything. And then in our annual employee survey, we noticed that our stress levels had spiked. And we dug a little deeper and we found out the culprit was an unhealthy meeting culture. So we turned to the psychological science. And what we found was actually pretty nuanced. Video meetings can be particularly draining, especially for new employees and for women. And we're all staring at our little image all day long, which is not great for self esteem for a lot of us. But it's not either or, which was the biggest lesson I think for me in the pandemic. Video is really powerful for certain moments, first meetings, delivering difficult news, celebrating wins, building connection. It's not all bad. So, based on our research, we created the Meet with Purpose campaign. We asked employees to participate in aligned behaviors across the organization in multiple phases. And these were based on research with practical implementation. So, in the first phase, we asked our employees to indicate in your meeting invite if it's video required, video requested, video optional, or audio only. And we helped educate them on when video helps and when it actually can be pretty harmful so that they can make informed decisions that were good for their well being and also the well being of their employees. We also learned your brain really needs transition time. So when we're in the office, we have that break where we walk between conference rooms, and you also often have a commute. But when you're in back-to-back video meetings, that doesn't happen and your brain needs it. So we recommended 50-minute or 25-minute meetings, leaving 10 minutes or 5 minutes for employees to reset. And we encouraged employees to block time to actually get work done on their calendars and for personal needs as well, so that their colleagues could respect them as whole humans. Most importantly, I think through this campaign, our work started to shift from band-aids like yoga classes or EAP, which matter so much, but cannot really sustain well-being alone, to building systems where well-being is actually the default, where employees don't have to choose between their health and professional success, where the only path isn't necessarily through burnout. And that's the power of a campaign like Meet with Purpose that aligns our employees together to invest in their well-being, which drives organization success.
And you mentioned the word systems at Mindshare Partners. We're really anchoring on folks to look at a systems-based approach when you are approaching your well-being strategy. So I know we'll talk about the APA strategy later on in this interview, but thank you for mentioning that. So when we first spoke, I actually found your role to be really unique. You combine internal comms with employee well-being and sit outside of HR, but work closely with HR. Can you tell us a little bit more about this setup and share some examples of how communications and well-being can come together to make a real difference? For example, like your daily well-being email to the staff.
I love this question. APA's actually had an office dedicated to workplace well-being since the early 2000s, before I worked in this field. And as a mental health organization, our leaders have always known and been committed to the fact that employee well-being isn't sunshine and rainbows. It isn't just nice to have, it's essential for our success. So, importantly, our office actually sits outside our Office of People Experience, which is our HR office. And we get to focus entirely on engagement, well-being, and internal comms. And we're not focused on, things like performance management or benefits administration. We are really driven to try to create a healthy workplace for our employees. So our head of people experience and I bring together our skill sets and our experiences to work for good, and we partner together. But I think this really speaks to APA's commitment to this, to have actual salaries, designated towards well-being specifically and mental health in the workplace. So I started on the well-being side, and through organizational changes, I moved into our communications unit under our chief communications officer. Some people think that's really odd, but here's what I've learned. If you're not communicating with a well-being lens, with empathy, your employees are not hearing you. We see employees as whole humans with varying roles and responsibilities that shift day to day. So I lead both internal comms and staff well-being because I don't think they can be separated. Every communication that we send out considers well-being, whether it's from our office, our people experience team, our CEO. It's one voice that consistently says, you matter, we care about your well-being, and we know that your health, your happiness drives organization success. So there are three of us in our office, and our mission is to use psychological science to improve employee well-being and drive organizational success. And one of our main connection points, as you mentioned, is our daily email APA Today. It started years ago to reduce email overload and to ensure consistent messaging across the organization. We have about 560 employees, and then with contractors and such, we're at over 700. So we really want to make sure everyone is hearing the same message in the same voice. But this really came to life during the pandemic when we realized some employees might not interact with a single colleague or even another human being all day. This email became their lifeline to the work, to the purpose, to community. And we've evolved it based on employee feedback. So each edition of our email, which comes out every day, includes important updates like minutes from a conversation with our CEO, policy changes, system updates, relevant external content with practical applications like our apa.org page on seasonal affective disorder with science-based tips on how to manage that. It also includes a staff feature highlighting a colleague, and my favorite thing, a little spark joy button at the bottom that is usually a cute video of, say, otters swimming. We also include a list of important dates to remember. So our employees told us they miss seeing colleagues' faces, so we added the staff feature. So every day, a different employee is highlighted with a way that you can connect with them. They missed hearing about their colleagues' families and pets, so we created APA This Week, which is a Monday video edition where different employees say hello, they highlight their work, they answer questions of the week. It's our version of a weekend update, and it's really built connection in a remote workplace. So I believe this holistic approach, communicating with empathy, seeing our employees as whole humans, works. And our survey results show that as well. In our most recent survey, we had an 86% response rate, and 90% of our staff said they think their well being is a priority to APA. We take this same approach with our CEO's messaging. One example is our mental health days. So many organizations offer mental health days, but there are a few reasons I think ours are unique. We plan them well in advance, coordinating across the organization to avoid conflicts. And then our CEO sends out a video message or an email mandating no one works on these days. You shouldn't even be checking your email. They're more powerful than PTO because you don't come back to the office to a full inbox. The rest isn't negated. So the power isn't just in the days themselves, but it's in how our CEO communicates about them and how he models it, reinforcing that collective rest benefits all of us.
I absolutely love that sort of reimagined mental health day. That's awesome. So everything that you've talked about actually ties into my final question for you. The APA uses a three-pronged, science-backed approach to employee well-being. Can you walk us through what that looks like in practice?
So, as I mentioned, APA's mission is to elevate psychological science to improve lives. And my role, which is largely internal, for me, that means using the science to improve the lives of our employees at work, which they spend 90,000-ish hours of our lives at work. So we know that that has lasting effects, but also we know that investing in the well-being of our employees doesn't just benefit them, but also their families, their friends, their communities, our world. So we have a three-pronged approach to creating a workplace where our employees and the organization can together thrive. First, we pay attention to the data. So it might be external data like APA's Stress in America survey or our Work in America survey, which we put out annually, or it could be internal data like the survey I mentioned earlier that was showing stress levels due to an unhealthy meeting culture. Second, we see what does the psychological science say about interventions, prevention, or maintaining something that is working. And finally, we listen to our employees and we evolve. We love the word pilot. We pilot a lot of programs and we gather feedback continuously, not just through an annual survey, but through focus groups, through conversations, through pulse polls, and we adapt. So it's really this marrying of research and our employee voices. So here's an example. As I mentioned, pre-pandemic, we were not a remote organization. And when restrictions started to lift, we had to decide, okay, what kind of organization will we be? And who better to ask than our employees? The data from our employees showed that they were experiencing higher well-being than ever before in a remote workplace. And workforce surveys, like our Work in America survey, showed that employees with autonomy over how, when, and where they work had higher well-being. But it's nuanced, like everything. The national data was also showing rising loneliness, that we're a lot more lonely now. And so we looked at the research and it confirms that autonomy drives well-being outcomes and also that social connection is one of the most important determinants of quality of life. And when we asked our employees, they said, we really don't miss the commute, but we miss our colleagues. So all of us informed our decision. Our stance is really about maximum flexibility, not being a remote workplace or an in-person workplace or even a hybrid workplace. We are a largely remote workplace, but we have an office where employees can choose to work in person. And knowing how vital connection is, we've been incredibly intentional around building community in various ways. I don't have time to go into them here, but a lot of our systems are actually free or built on technology we were already using, and our employees report higher levels of connection now than when we were in person. So we kept listening. Our employees said, why do we have to live in DC if we don't work in person? It's really expensive, or I want to move and be near family or friends. And so we created a flexible work policy where employees can move to 43 states and keep their DC salary, which I think is the best part. And so we've continued checking in our recent survey with an 86% response rate. 95% of our employees said that they're satisfied with remote work. So I think this is another way in which we are trying to create a workplace where well-being is the default, where employees don't have to choose between their career and their family or their friends or what really brings them life. That they really can have both in a workplace where their well being is prioritized and the organization is successful. And it's not perfect. We're constantly evolving and growing, but I'm really proud to work in an organization that walks the talk when it comes to mental health and well being.
That's awesome. A workplace where well-being is the default. I love that phrase so much. And it sounds like the APA is truly living that. So thank you so much for joining me today, Tara. It's been incredibly inspiring to learn about the work you're leading.
I could have talked to you for 2 more hours. So thank you so much for your insightful questions. And I've really enjoyed the focus on this topic.
Awesome. And be sure to check out the links below to follow Tara and the APA and some of the resources that Tara was mentioning. And don't forget to subscribe for more interviews like this one.